Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Well, hello, and welcome back to the Healthy Living Podcast. I'm your host, Joe Grumbine, and I have back with me today Dr. Robert Hoffman. And Dr. Robert, welcome back to the show. I'm so glad you could join us. How are you doing today?
I'm doing good, Joe. Thank you. How are you?
I am doing great.
Can you see me?
I cannot see you, but
Okay, I'm not hiding. Just a moment.
not to worry, not to worry. Yeah, when we record these things, we usually
Yeah,
turn
hang on for me.
the video on so we can see each other.
Okay.
Here we go.
No. It reverted. All right.
There we go. I got you
There
now.
we go.
Excellent, excellent. All right, my friend. So, for those of you who are listening, maybe for the first time, Dr. Hoffman, I met a few weeks ago in my journey through solving a cancer problem, and I came to discover there's this amino acid called methionine, and Dr. Hoffman was involved in discovering the mechanisms that the cancer cells have this great affinity for this amino acid, and it turns out that they want it very badly all the time. And Dr. Hoffman was involved in developing or discovering an enzyme that basically blocks it out, and it has become a cutting edge therapy that increases the benefit of all other therapies in such a dramatic way that I want to continue this conversation, as I believe it's going to affect a lot of people, especially as more and more people are finding, themselves being diagnosed with cancer and being faced with all these crazy new experiences and a wealth of, confusion and hopelessness and being lost. And Dr. Hoffman created a group of people that are all going through similar circumstances, people that are um, either supporting somebody or going through a cancer ordeal themselves. And in addition to providing counsel and these compounds, we share once a week, we share a hearty conversation about our progress. And I can't share with the audience how important that is. So for me, it's been 2 weeks since I met these guys. I've joined two conversations, and last week, the group really embraced me, and I was able to have further conversations with three different members of the group after the group. And I have since spoken with a woman from Israel who was part of the group and has gone through a similar circumstance, and she's given me some counsel. I spoke with a guy named Lowell who has been using this diet and supplement for many years, and he was able to share with me some great information. And another person directed me to another person to look up. And when you go for those of you who are listening, and maybe you just recently got diagnosed with some kind of cancer, when it happened to me, the doctor basically said, "You've got this, and I'm going to issue a couple of vague orders." And then you just like get pushed over a cliff, and you don't know what that means, and you don't know what to do, and you don't know what the right answer is. And everybody starts telling you what you ought to do, and nobody agrees with each other. And one person says you got to do this, the other person says you can't do this. And you're not talking to people who know what you're dealing with. You're talking to people who heard something from somebody, and it's just chaotic. And I would have to say that my experience with being diagnosed with cancer, the most impactful experience I think I have dealt with is confusion, just because of the sheer volume of information that's out there. And I suspect most of it's poor. Um, Anyways, I find myself here rambling a little bit, but the point of this ramble is to really highlight the value of these conversations, real-time experiences. Every cancer is unique and different, and there are some similarities and things we can learn from observing larger groups. Dr. Hoffman, you've been at this for a lot of years, and I respect your process. I think that's one of the reasons that I find this group very valuable. It's because I don't have to agree with everything everybody says, but I can agree with that. I respect the process these people are going through. And you almost can't agree with everybody, can you?
No way.
That'd be like
Can't
saying,
even agree with yourself sometimes.
I'm telling you. And I think that that's one of the most complicated things. You get told you've got this condition and you don't even really know what that means. And then you've heard what you've heard, and then you got start talking to doctors. And in my case, I had one doctor say, well, you probably don't have cancer, so you're okay. And I just let it go for 9 months, which dramatically affected this in a negative way. Then I find another guy and he goes, well, yeah, you probably do have cancer. So let me go cut a piece off for you. And then the next guy says, well, yeah, I'll operate on you, but we're going to have to give you radiation. And then the next guy says, well, you're going to have chemo. Well, then yesterday. So that brings us up to this crazy moment. And I kind of brought the chaos in because yesterday I went to a doctor and in my journey, I've gone to a general practitioner who sent me to a ear and neck or head and neck specialist who did a biopsy, sent me to a surgeon, and he wanted to do a bunch of different things. And this guy that I talked to yesterday was a radiation doctor. And when I went to the place, first of all, the medical center was state of the art. They did a great job. I didn't wait very long. Everybody was very professional and thoughtful. UCI Medical Center, good job. You guys are doing a good job. But the first person I saw, I believe, was a resident, so a young doctor that is, past the test, but he's practicing, for the first time. And it was interesting because he asked me how I saw my situation. And I never had a doctor ask me that before. And so I got a chance to reflect and say, well, here's what I know. And I told him my story. And I thought that was good because I think most of the time doctors don't really want to hear what you have to say. They want to tell you what they think. And so um, we talked a little bit and he started telling me about what he thought about some of the possibilities of a way forward. And eventually the second doctor came in, who's the senior doctor. They ran a camera down my nose and ran it way down into my throat. And I was able to see a portion of the tumor. And that's pretty startling. So if you ever get the opportunity to look a tumor in the eye while it's still breathing, it's quite a force to be considered. Got me thinking a lot. Ultimately, what the doctors had said is they believe that my condition is treatable, which everybody seems to agree that but it's also very severe and needs to get moved on quickly, and everybody seems to agree on that as well. Their recommended course of action was that they wanted to bring the surgeon in on the team. Apparently, the surgeon had ordered an appointment with me for another oncologist, a medical oncologist, and I didn't even know about it. So their whole communication system had an appointment or orders for an appointment that I had no idea of, and I believe this is the guy that wants to talk about chemo. What their suggestion was to me was to do a very aggressive radiation treatment that was going to basically hit me. They're gonna create a cage to put my head in. And basically my head's gonna lay down on the side of a table. They're gonna screw my head to the table so I can't move around. And then they've got this little, ray gun that they program with a computer. And they have it programmed for various cycles of various frequencies. And it's supposedly very precise and very cutting edge and is able to deliver radiation the way they want to, near the areas they want to hit and avoiding the areas they want to avoid in a pretty good way. But their thought was they wanted to hit me 5 days a week for 6 weeks. And I thought that was a pretty aggressive first offering. They also said that they want to get together as a team and, basically talk about my plan, which I thought was a good idea. I certainly want anybody who's involved to be talking to each other. And then I asked them about, like we talked in the last meeting about an oncologist that was not a surgeon and was not a chemotherapy doctor, right?
No, is a
Oh,
chemotherapy
is a
doctor.
chemo. Okay, so I believe
That's so-called medical oncologist.
yeah, that's what I now have. So I've reached out to their office. I haven't got the appointment yet, but I have an order to get that. So we're good on that. Um, the goal is to, get all these guys to look at my situation, put their combined um, experience together and come up with a good plan. But I believe this whole concept of methionine restricted diet and the methionase, um, the idea of it is it strengthens your body by weakening the cancer, and it creates an environment where other standard traditions that they call them, or standard treatments, will work better, considerably better, and possibly have a reduced or even negligible side effects. Am I running through this right, do you think?
Yeah, yeah.
And
So,
so what my hope is I get this medical oncologist, he does his analysis, and then I already told them the things that I'm doing. I told them all the wacky things I'm considering doing, the ivermectin and the fenbendazole, and I told them about the methionine restriction. I told them about I just told them, I told them cannabis oil, all these things that I'm doing. And they generally didn't think that there was a problem with any of these. They didn't have any suggestions about it. The only thing that they said, and I thought this was wise or good advice, was they said, just don't go getting yourself into antioxidants. And I told them about, working with ozone, working with the oxygen-rich environment. He says, that's solid. And so it didn't seem like they were fighting me as my approach to it. But it seriously seems like they're, trying to run their medicine down my throat, if you will. But they did say this, and I was a little excited about this. And two things happened. One, I've got this giant, ugly grapefruit sticking out of my neck, and it's changing its shape, and it's scary shit. But the good thing that he told me, and I wrapped my head around it, he says, yeah, but you can see it. So if something starts working, you'll be able to see it happen quicker than if it's happening inside of one of your organs and you got to keep running tests. So for that, I thought, okay, if there's going to be some bright lining to this whole thing, I says, that is good. You're right. I can see it. And as we've been talking, it can take 3, 4, 5 weeks or months even before something you do starts showing, starts showing results, right? And that's one of the biggest difficulties in this. And so I just wanted to share with you, since we've last spoken, these are the things that I have gone through. Also, Dr. Castro, they got back a hold of me, and his receptionist is sick, but we'll have an appointment set by next week, so that we made progress with that. I'm being as aggressive as I can and not trying to push too hard too fast. And
okay, Joe. So let's you got a good team together now.
yes, I believe
So
so.
let's just do logic.
Okay.
Just logic.
All right.
Okay. So let's say we start with surgery. Let's just say.
Mm-hmm.
So the surgeon has very limited vision how far away this tumor is, how far it's invaded.
Correct.
The chances of the surgeon in this case, so-called getting it all out, not very high.
I agree.
Okay, then we go to the radiation.
Mm-hmm.
Well, the radiation, they're going to screw your head down to the table, and they're going to radiate.
Right.
And the radiation will probably, it'll be quite aimed, but it still may not go all the way to where your tumor is gone. We don't know.
Correct.
Can't see. We don't
Right.
know. Okay. All right. Then we go to the oncologist. And he's going to give you, he, she, excuse me for saying he all the time. I mean he, she, is going to give you a systemic therapy.
Right.
This tumor is already systemic.
Correct.
All right. So let's reverse the order now. We start with the oncologist, the medical oncologist. He's going to give you very workhorse drugs, cisplatin, methotrexate, 5-fluorouracil, all the great drugs that have been around for 70, 80 years, and they've shown their worth. So the drugs know no border. They're systemic. So they have a good chance of at least contacting all the cancer cells that you have.
Right.
That's a good thing. And as an aside, we're hoping that the methionine restriction diet, methionase, is going to make the cancer cells more sensitive. Okay. So the drugs do their thing. Will the drugs kill all your tumor? I don't think so. It's so big.
Right.
But they have a good chance of getting to the boundaries of this thing, which are probably, the old, how do you say, the symbol of cancer is the crab.
Right.
And that goes all the way back to ancient Egypt. It's the crab. So, okay, we start with chemo. And the jargon for starting that way is called neoadjuvant chemo. And that's just so you can talk the lingo.
Okay.
All right. So then we do a good job there. But there's still some tumor left. We're going to assume that, maybe considerable. And again, the surgeon's knife, is the surgeon going to be able to see all of that that's still left? Probably not. But the radiation can go beyond the knife. So we do radiation second.
Okay.
And we get this tumor much more circumscribed and much more small. And then the surgeon comes in.
Okay.
And she have the best chance to get it out. We first zap it with chemo to get all the crab wherever it's gone out. Then we do radiation, which doesn't have the range of chemo, but it has a greater range than the surgeon can do.
Right.
So hopefully by the time the surgeon comes in, we're way ahead of the game. Now with Ms. Hozumi and her metastatic breast cancer, the chemo wiped it out. There was no need for surgery or radiation. She was on methionase and low methionine diet. That was kind of a miracle.
She was talking about some other nootropic compounds she was taking as well, I believe.
Yeah, well, she's taking all these little things now as maintenance to keep the damn thing from coming back.
Yeah, but she says it's so small she can't even. It doesn't record right now.
No, not even on the very most sensitive PET scan.
Right.
So you got a team. Are they thinking logically? They're all individuals. Can they put it all into one thinking? I don't think so. Right. But you can.
Right.
And it's just logical.
Yeah.
You start with chemo to get this far out stuff as much as you can.
Yeah.
Then you come in with radiation to try to get more than the surgeon can get. And then you come in with the surgeon. So that's the order I would do.
As a patient talking to a doctor, there's a level of communication that sometimes is difficult to break through for the reasons that
it doesn't matter. You just have to be strong and say, this is what I want to do.
Yeah, perfect. I have no problem with that. I
That's
just
what Hozumi did. She just said, "This is what I want to do." The
perfect.
guy said, "We're
Perfect.
going to operate you on you now." She said, "Why the heck are you going to operate me? I'm cancer free. Leave me
Yeah.
alone."
Yeah. Good. 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 Well, that's what I'm after, and this is the thing that like there isn't a manual for this stuff, and people think,
There's
well,
no manual, and
if
there's
I
no sure. The problem with cancer, it's
right,
not like diabetes. Okay, you're going to go on the insulin and you're going to be good.
right,
No,
exactly. Nobody knows what's going to happen next.
there's no insulin for cancer.
Correct.
So every 90% of it is, this is my guess, go to a tumor board sometime.
Yeah.
This is where the docs get together and discuss individual cases. Well, I think this, and the other guy says, "Oh, I think that." And
Yeah.
you get blown away. It's so imprecise
Right.
because
And I
that's the state of the art.
exactly. Exactly. And I think that's important. People
Use
need to hear this.
logic.
Yes.
Logic can take you a long way.
Yes.
Which of these, the chemo doctor, we called him the medical oncologist, the radiologist, and the surgeon.
Right.
What order are we going to use them in?
Right. And they were even talking about possibly, so, for listeners who are not looking at this, this is a big thing. It's like you can't stop looking at it. It's big and ugly and gross and it's a thing. But it's also in the back of my tongue where I can't see it. And what the doctor said about that, he says, well, look, if when we operate, you're going to have a space where that used to be. And
But
we're
we
going
have
to,
a chance. We have a chance, Joe.
right.
After chemo and radiation, it won't be there anymore.
Agreed. And that's what I'm thinking myself.
That's what we need to. We need to get this thing shrunk
Right.
before we let the surgeon in with the knife.
100%.
And then, even before letting the radiologist in to burn the living hell out of you,
Yeah.
we need to have some shrinkage too, so he
Right.
doesn't have to radiate your whole face.
Exactly.
So that's it's so logical.
Yeah.
Now we need to know, after chemo, are you compromised? You may not be able to get all the radiation you could if you didn't have chemo. These are things to talk about.
Right.
But the surgeon really put it to you. You're going to
Yeah.
have a space back there because I'm going to take out so much stuff.
Yeah.
You're going to be deformed.
Yes.
And you can. The answer is, hey doc, let me try to shrink it a little before you cut me up.
Exactly.
So, two ways of shrinking. The most systemic way, and this thing is crabbed. It's all over there,
Yeah.
and it might even be in your lungs.
It could be.
But the chemo with especially with a low methionine diet, methionase, has a chance to zap a lot of that thing. Can the
Right.
chemo cure a great big tumor like that? Maybe sometimes, but I wouldn't count on it.
Right.
So then you bring the radiologist in to do step 2. I'm going to shrink it more.
Right.
And then the surgeon is ready to get it out of there without deforming you.
Right. Agreed. I think that this is important because all of these pieces, people just, they don't know. You don't know. Nobody knows anything.
Not only they don't know, because we don't know,
Right.
but there's some logic. I don't know. In the doc world, do they emphasize logic? I don't know. I'm not part of their world. But
I wish they would.
I need logic all the time.
I agree.
So, and that's the way my mind kind of works. And so that's the way I look at it. Hey, wait a minute. Let's start and shrink this thing down as much as we can to make the radiation work better. And let's put some radiation in to make the surgery less deforming and more chance of getting most of it, if not all of it.
And I think one of the things that I've gained from the reality of all of this, if there's anything that happens, if you ever get diagnosed with cancer, you get a real dose of reality, and it's the kind of reality that isn't political, isn't religious, doesn't care about you, doesn't care about anything. It's just a hard truth you gotta wrap your head around, and in doing so,
not only that, Joe, you got to think for yourself and study.
Yes. And
the cancer, what I'm learning, the cancer patients who study do better.
Yes. And I'm learning more from these patients. They're telling me words I never heard of before.
Me too.
I love it. I love it. It's powerful. and everybody's got their own motivation to go find their own thing, and I'm no different, and that's what's happening. I'm trying to solve my problem, and I know by solving my problem, I'll help some other folks solve theirs along the way. And you
Yeah.
know, none of us in this group are sharing the same experience. Even people that have the same type of cancer,
Oh, no, of course
there's a
not.
different experience for every single person. So
Yeah.
this collective clearinghouse, I think the doctors need to do this. Like you said, these tumor boards, at least they're having conversations about, the varying opinions about what should be done.
It's pretty scary. I think this. No, I think that. Oh, no, 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 you do that.
Wow. Well,
It's
I
a
got
very imprecise science, if you call it even a science.
I think that the most value comes from the people that are practicing the most. I think that's where the knowledge comes from. That's where the changes happen. I think that's
Yeah,
what
the people who practice the most, of course, have the most knowledge. That's the big advantage of a big medical center like UCI.
right.
Um, and and but nobody knows as much about the cancer as the patient.
100%. And for those of you patients, if you've ever been diagnosed with cancer and you just think I'm just going to listen to my doctor and just do what he says and don't jump into this yourself, I'm going to implore you to at least take a minute and just take a look. Take a look for yourself about what your doctor's telling you. And
Well, what the doctor's selling you, I mean, hey doc, what's my 5-year prognosis, doc?
right,
And if you got pancreatic cancer, if he's honest, she is going to say 10%. But
right,
this is what I got. This is the guidelines. This is what I'm going to give you.
right.
90% ain't going to work. Gee,
Yes,
doc, maybe we ought to do a little something in addition.
exactly. And that's the key, I think, right there. So I came into this with an opinion. We all have opinions about things that we don't know anything about. And my opinion was, chemo and radiation are just terrible poisons, and there's natural ways to solve these problems. Well, the truth is there may be natural ways to solve these problems, but chemo and radiation are a tool that have been shown to work in a
Yep.
particular way. And
The other stuff are enhancers.
right.
You
And
cannot, when you have a cancer like you have, you cannot do without chemo, radiation, and surgery.
oh, there you go.
You,
And
you need them, but they need to be done in the right order. And then we need to enhance because this cancer can be very nasty. It can metastasize to your lung. And sometimes the surgery will stimulate the cells the surgeon didn't get out.
exactly.
This. So going on methionine restriction and some maybe maintenance chemo after, we need to keep our minds sharp and working. To I mean if you go on our Zoom call, the ultimate of this is Dr. Exame.
Yes.
He's one step of his cancer, one step ahead for 4 years. He was supposed to be dead 4 years ago for stage 4 lung cancer.
Right.
And very interesting. We're going to pass out an article from the New York Times the other day. This doc at Stanford taught a course on his lung cancer and the Times, and he both called it terminal. He was so passive.
Yeah.
This is what's going to happen. This is what's going to happen.
Yeah.
Just the opposite of what we do.
Right. No, I totally agree. I think the patient, it's your responsibility. You have to take ownership. You have to find and be your own advocate. You have to take the lead. Nobody's can care about this more than you. And nobody's going to do more for you than you will. And finding people that care, people that'll share their information, probably one of the best resources you could. Having even somebody just to talk to. I think it's important just to have a community that you've got a way to release, the angst and stress that this gives. I think it's just it's the community aspect of this is powerful stuff. Well, Dr. Hoffman, we've burned through a bunch of time. I really wanted to just walk through this experience and reiterate, the importance of sharing information, the importance of every patient thinking for themselves and really doing that legwork. There's answers that come up sometimes after people have been given that death sentence. I don't know how many people that I know in my life that were told they're terminal and they said, well, okay, I'm glad you have that opinion, but I think I'm gonna revisit that myself and see if I can't come up with a different answer. And these people are still here. And I think
You
that
bet.
that's the key. That's the key
You
to it
bet.
all.
What you did today, Joe, just describing what happened at UCI, talking to all the different doctors, that was very, very helpful. And it confused you a bit, and it confuses probably most everybody else. But if one takes the time just to logically construct a path,
Right.
let's see, which one should I do first? And which one should I do second? Which one should I do third? Logic pretty much tells you what to do.
Yeah. Yeah. Because he was talking about doing chemo and radiation at the same time. And
Well, I'm a little scared of that.
I am too.
Why not give the chemo a little time to work?
Yeah. Yeah.
Um, Shrink, because the chemo is not going to shrink it right away.
Right.
And then the radiation will not be able to radiate all the areas that the cancer has gone to, probably. So why not give chemo a little chance to shrink it?
Right.
And so that you don't have to burn your whole head off.
Well, and I look at it this way too. With these other therapies, I'm doing ozone therapy. I'm doing all kinds of things that
All
hopefully
can be done at the same time.
exactly they're not a conflict of interest. And
No, they're not mutually exclusive at all.
exactly. So that's what sort of my plan is I'm going through sort of stacking a plan around itself, saying, okay, is this going to hold up? Is this make the most sense? That's kind of what I'm thinking is continuing the boosting uh, elements, and I'm this close to ozonating my glycerin. I've got the last part I needed to connect up the tools together. So I'll be making ozonated glycerin starting tonight, and
Terrific.
I'll have it. The first batch will be ready in 4 days. So that'll be the beginning of a thing that I will begin to consume for the purpose of yeah, give it putting leverage. It's really the way I look at it. The methionine restriction, the methionase, the ozone, every oxygen. I'm doing peroxide. I'm doing all kinds of things to oxygenate the area because cancer doesn't like the oxygen. And well, you know what? Good thing they did my O2 test. I was 99%, and I hadn't done anything recently to increase it. So I think that at very least I'm creating an oxygen-rich environment. I feel great. The one thing that the radiation doctor was telling me about, and I never heard this before, he says you got to go to a dentist and you got to see if there's any teeth that need work on. And if you're going to have teeth that need work on, you want to do that before you get your radiation. You heard about that?
It makes good sense.
Okay. Yeah. I mean, my teeth are in decent shape, but I'm going to go get a checkup anyways and just
Can't hurt.
yeah. All right. Fair enough. It seemed reasonable to me as well. The type of damage radiation can do to things like bone marrow and bones, it's pretty.
Well, I mean, if we can shrink the tumor before
Yeah.
the radiation can shrink the tumor before the surgery.
Right.
I think it's good.
I think so too. And Dr. Hoffman, I got to tell you, I think the biggest thing that I've gained from this experience is that I have taken an approach that used to be radiation and chemotherapy are just have no value that is positive and everything they do is negative to it. I'm accepting them as a usable tool that can be
Necessary tool.
a necessary tool. I'm even going to go that far. I'm going to agree with you. Oh, and I also got a set of calipers.
Good, good. So keep a daily record, Joe.
I'm doing that. I'm going to measure it tonight. I measured it yesterday. I'm measuring
Very good.
three different points. I'm going XY axis and then a height. I'm trying to do three different points. So
Terrific.
yep. All right. Well, anything else you have to share with our audience today?
Well, I'm just really glad you went to UCI, talked to all the docs, and from that we can make a plan.
Exactly. I'm going to keep on punching through this and
Yeah,
punch.
well, I think you found a good place.
Yeah.
I think we could use Dr. Castro as kind of an add-on,
Yeah.
but I think UCI is your place,
Okay, good.
and Dr. Castro almost surely will give you some additional things to take.
Okay.
All good.
Mm-hmm.
Yeah, you're in the right place, Joe.
Awesome. All right, Robert. Well, I appreciate that. And
My pleasure.
I'm looking forward to getting my methionase.
Okay, well, you're going to get it next week.
Fantastic. Thank you so much. All
Thank
right.
you, Joe.
Appreciate you being a part of this show. I'm looking forward to talking more next week. And
All right, you just tell me when you want me, and I think we're going to do another thing.
Yep.
Next time, you're going to give me a phone call about 15 minutes before.
Perfect. That works out all right. I'll do that.
Okay.
Awesome. All right. Thank you, everybody, for supporting the show, and we will see you all next time.
You bet.
This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right. Well, thank you for supporting this show, and we hope you've enjoyed it.